Okay, we'll go ahead and get started. I am dropping a link to the PDFs of, maybe I am, of today's session so you could follow along. They will also be on our Canvas page and our, and that's all where the PowerPoints will be, is on our Canvas page. It's been a long week already, obviously, if I can't even think of the words I'm trying to say. So welcome. If you'll just put your name and contact information into the chat. We are recording today's session. Those will be stored on our Canvas page and YouTube channel for you to always go back and review, as well as share with other colleagues or family members. We do ask if you're comfortable to turn on your camera. It's always easier to see who's on the call, to know who we can reach out to with all of the amazing ideas and conversations that will happen in today's session. Please, if you have any questions, put those into chat. Kurt Phillips, one of our hub members, will be monitoring that for us. We are going to have some time at the end, so don't worry, Kurt's going to be monitoring those questions, and we'll make sure your question gets asked at the end. We ask that you do protect individual privacy, so try to avoid names or addresses or where they live and work, all of that information. But if you have any questions, reach out to a hub member. They all have an asterisk or will have an asterisk in front of their name, so they are easier to find in chat. Key components of an ECHO session is that we will always have a didactic speaker or a presentation, and then we do professional networking. So that's why we asked you to turn on your cameras, put your name and contact information into the chat, so that when you hear or see something like Lisa Coleman, just put hers in there. She may share something really brilliant and I want to follow up with her. And so I know how to reach out to her. And then we always do a case presentation with all of you amazing people on this call giving those recommendations. If you've not done a case presentation, please reach out to us. It's a great way to get a ton of amazing resources and recommendations from everybody on this call. I've done several of the case presentations for families that I work with in our early intervention Part C program, and I can't tell you all the amazing things you guys all come up with. I love it. We've all been on Zoom for a while, so know how to hopefully rename our profile, but here's, if you'll take a minute, rename your profile, where you work, where you're from, your discipline. Again, it's really just that way to know who is on the call and how to reach out to them. So building that professional networking while we're over here on the Zoom world. Raise your hand is right next to your participant down at the bottom. And then in order to get a credit for attendance, we do ask that you fill out the survey. We thank everybody who always fills out those surveys. It gives us the information to take back to our funders to share and show the amazing work that is going on because of these ECHO sessions. Shayna will be dropping the survey out link throughout today's session, as well as in a follow-up email. Canvas is where we store everything. So if you would like access to our Canvas page, please email us at earlyecho@usu.edu and we will get you access to our Canvas page. And then again, just another plug for our case studies. If doing a case study, you really want to do one, but you don't want to talk or share anything, reach out to me. I will be glad to present your case for you so that you can get all those amazing resources and recommendations from everybody on the call. We do have a Facebook group that we're hoping to continue discussions about sessions after. So if you want to join that Facebook group and continue to talk to everybody on it, here is the link for that. As well as we just have other social media sites that we share resources, upcoming sessions about all the echoes that are happening here at the Institute for Disability Research, Policy, and Practice. I am going to stop sharing and turn the time over to Gretchen, who is going to be presenting to us today. So, Gretchen.
Trying to unmute. Hello, can you hear me?
Yes.
Okay, welcome everybody. Today is World Autism Day, so I just wanted to give a little shout out for that. And April is World Autism Awareness Month. And so we're going to be talking today. I just briefly wanted to say, first of all, I'm brand new at the UPC, so this presentation was just given to me today. But I'm excited to kind of share the little knowledge that I have, but my colleague Lilium is here with me as well, and she will chime in if I make any mistakes. So we will be showing some QR codes as we go throughout the presentation. You can simply scan the QR code to learn more about the information that we're talking about. If you do not have the ability to scan a QR code, look below the code for links, and you'll be able to get the information that way. So I just wanted to start with a little introduction about myself. Once again, my name is Gretchen Selcho. Is 22, and he was diagnosed at age 2.5, and we lived in Texas at the time. And this journey has been amazing and fulfilling and full of peaks and valleys, but one that ultimately I wouldn't trade for anything. The mission of the Utah Parent Center is to help parents with their children, youth, young adults with disabilities and special healthcare needs to live included, productive lives as members of the community. We accomplish our mission by providing accurate information, empathetic peer support, valuable training, and effective advocacy based on the concept of parents helping parents. Utah Family Voices was started as a volunteer effort in 1993 in partnership with our National Family Voices Network as a way of helping to advocate for and assist families in navigating and accessing healthcare and family support services that are family-centered and culturally appropriate for children and youth with special needs. We advocate for and assist families and children and youth who have special healthcare needs and disabilities in navigating and accessing healthcare, family support services, ensuring safety and wellness, creating a system of care, and giving a voice to families and individuals with disabilities. All of our parent consultants are parents with children with disabilities of varying ages and needs. We feel this allows us the opportunity to provide some real life experience and empathy to parents who come to us for support. Though each child's diagnosis is unique and each parent may react differently, many parents report feeling anger, sadness, disappointment, fear, denial, rejection, guilt, and grief, and sometimes the feeling of complete lack of control when their child receives a new diagnosis. On the other hand, sometimes a diagnosis can come as a relief. Finally, their child can begin getting the right care for their condition, and parents can understand a little bit more about what makes their child tick, and how to best help them on this journey. Sometimes it can mean that you're in limbo, waiting for treatments or understanding how to move forward with therapies. As I mentioned before, my son Jack received his initial diagnosis at age 2.5. We had recognized that something was different earlier than that, but it was a long process of getting him to a diagnosis. We felt a sense of relief, but also still completely overwhelmed at the same time. We were told that there was nothing that we could do for him, and this just did not sit well with us. So we got to work and we spent every waking moment for about 2 months researching and talking to anyone who might hold some answers or some hope. No matter what emotions a family might experience, it's important to validate those feelings and let them know that they are a normal response to the circumstance. When a child is diagnosed with a disability or a special healthcare need, the family may face a time of uncertainty while they learn about the diagnosis and sometimes beyond that. Today, we will go over a list of 10 things we can encourage family to do that might be helpful to focus on after receiving a diagnosis. The QR code on this page is linked to an article from the National Parent Center Hub called "You Are Not Alone." It is written by a parent about recently receiving their child's diagnosis. It's also available in Spanish as well. When receiving a diagnosis, parents and families are often overwhelmed. And when you feel this way, it's important that you pause and take a moment. The most important things are right there in front of you. You have your child, you have family, and even though you may have feelings of sadness, grief, fear of the future, you are a parent of a wonderful child who needs you. So it is important to take a breath and think about what is most important to you. This can help you put things in perspective. Okay, and this QR code takes you to a 2-minute mindful breathing challenge that will be helpful for kids and adults. Okay.
And I'm putting links in the chat.
Oh, okay. And the links are in the chat as well. Sorry. Okay. Understanding the diagnosis. When a parent first talks with a medical professional about their child's diagnosis, they may be confused by the information, even the language used. Usually along with the diagnosis comes a whole lot of unfamiliar medical terms. It may be difficult for them to understand at first, but you can help them grow familiar with this knowledge and will be part of their ability to help their child. Encourage them to ask, we should encourage people to ask nurses and other providers to explain what they are talking about more, and have them write down or provide a handout about what you are discussing that day. Encourage them to also ask the doctor for anything they read about their child's condition. It is important that you feel comfortable with your team of doctors. So finding the right people who will help and welcome questions and concerns, and to take time to help you to understand the diagnosis. I think this is really a pretty critical key, is to find the right team and to build the right team for you and your child. You can also invite them to write down questions that were not answered in the first visit, and as they go along, and arrange a little extra time for a future visit or an appointment to discuss them. It's also important to encourage them to schedule follow-ups, so it's likely that they will have even more questions the next time after taking some time to digest the news and to research their child's condition on the internet, which leads us to number 3, which is beware of the internet. It is very common for parents of children who have just received a diagnosis to immediately start searching the internet for information about their child's condition. I mean, I think this is pretty likely scenario. All of us use Google to be able to try and figure out what we're experiencing in different realms of our life. Learning about a diagnosis is useful, and the internet is full of good information, but for all of the good, there is just as much bad or inaccurate information. If they are going to do research on the internet, I'd like to share some of the following guidelines that will help make sure that they are reading from quality sources. So first, it would be important for you to find the author's qualifications on each site that you visit. If you can't find anything about the author's credentials, you may not be reading a trustworthy source. Next, look for the mission and the target audience of the website. The information should add to anything and not try and replace the doctor-patient relationship. Next, read the website's privacy policy regarding personal information visitors give to the website. And lastly, look for the sources of health information, the date it was published, or the last update on the page. Current information and recent updates show that the information is more likely, to be relevant and possibly responsibly managed. Think about the reasons for the claims about any product, treatment, or services. And are these product, treatments, or services evidence-based? Is the website trying to sell you something? Does it have a sales focus? And it might mean that this website is probably biased if they are. And if you're thinking about a treatment or a product or a therapy for your child, share this information with your primary care doctor. So that's why it's important to build a good team. You should be able to have a relationship with these people that you're able to talk about the things that you are reading and researching and bounce those off of them to make sure that you're in a safe spot. Next, find resources in your area. Today, I will give you 3 of the main resources in Utah that will be helpful to parents of families of kids with a new diagnosis. Each state has a Family Voices or a family-to-family health information center and a PTI, which stands for Parent Training and Information Center. Generally, these organizations will be able to help you address the individual resources and support you might need. Here in Utah, we have the Utah Parent Center, which is where I work, and Utah Family Voices under one roof. If you contact Utah Family Voices or the UPC, we will work with you to help you find the best resources to navigate and somebody to assist you on your journey. And as I said before, we use a parent-to-parent model. So this is parents giving other parents support and guidance down their path on this medical journey or special journey. Let's see, you may hear acronyms in the beginning of your journey like DSPD, MCCW, ABA, SSI. I'm not going to try and tackle any of these today, but we sure can help assist you to understand all of these things if you set up a parent consultation or give us a call. And all of our services are also available for a Spanish consultation or language translation upon request. The Integrated Services Program is part of the Bureau of Children with Special Healthcare Needs and Utah Health and Human Services. The Integrated Services Program assists families of children and youth who have special healthcare needs by facilitating direct clinical services, care coordination, transition to adulthood, and advocating for primary care and comprehensive healthcare needs. And as I said earlier, Spanish care coordination is also available. Okay, so start lining up services. It's important to advise parents of children in need of specialized services such as early intervention, ABA or other therapies, or special education, to make calls to connect with the providers or the school district as soon as possible. It can sometimes take a while to get these services started, and some providers have wait lists. So they won't want to wait to make these calls. If they run into any problems, they can always call us at Utah Family Voices or the Utah Parent Center to help them to provide providers and connect them with school districts or anything else they need. When my son was pre-diagnosed, we were calling places that would help us to get a diagnosis for him. And at this time, the wait lists were over 2 years long. And then once we received an autism diagnosis, we were told that the wait lists for ABA were 6 months to a year. It can all feel very helpless and hopeless when you have a child who already needed help yesterday. But I think it's important to remind parents to keep calling and to keep reaching out, and always advocate for themselves to get on a cancellation list or the first call if something does come open. It's important to make checklists. I put alarms on my phone, different things to help me get organized, to start lining up the services, and then once they're in place, to keep track of them. So it's important to be well organized in this instance. Okay, understanding the laws. It is important to become familiar with disability law. It might feel like you are all of a sudden a mom, a healthcare provider, and you also need to have some legalese in your tool belt as you go on this journey. But to be able to be a successful advocate for your child, you're going to need to become familiar with these things. There are certain rights and responsibilities for students and individuals with disabilities, and this will apply to your child as they grow. A few to be aware of are the Americans with Disabilities Act, which is ACT, ADA, the Individuals with Disability Education Act, which is IDEA, and the Section 504 of the ADA. And then, we've included some links on this page that might be appropriate for review at this time. Other legal concerns. It is important for a parent to know about some legal situations that would affect your child with a disability. Legal issues can come up anytime in your child's life. And when there is a child with disability in a family, legal issues like divorce, custody, guardianship, which is really critical for most people, and trust must be handled with careful care and consideration of the child and how they will be affected. Okay. Let's see. Take care of yourself. It is time. This is a really critical time in your life where parents will experience more stress and more anxiety than usual because they're entering a whole new world of unknowns. It is normal to have these feelings, and getting good sleep, eating right, spending quality time with your family and friends is just as important as it is as any of the items on the list. You shouldn't feel bad about taking time for yourselves. It is essential so we can be a good parent to our child and to provide them with the best care possible. I learned that self-care is something that we need to do, but I don't necessarily feel like we often do. I often felt guilty for taking time away from my kids, especially from the two who had special needs. And like the items listed above, for me, it's important to make time to do things like work out. And sometimes you just don't feel like working out. But once you do, you always feel happier and more accomplished. There are many things on the self-care list, and it doesn't always have to be something, structured or that costs money. It can even look like giving yourself permission to take a nap, or just to do nothing, maybe binge watch a show that's your guilty pleasure. It can also look like surrounding yourself with people who are supportive and loving. These are really important things for families, especially for caregivers. Okay, moving on, taking care of your family. It is important to gauge how the family is handling a new diagnosis. What about siblings? What about your partner? It's important to encourage sharing feelings about the diagnosis with each other. And it's important that everybody understands the diagnosis and how to talk about it and how it makes them feel. I think what's really important here is to emphasize that nothing has really changed. Your child or their sibling is the same son, daughter, brother or sister, and making sure every sibling gets the appropriate attention that they need and help making them feel like the diagnosis isn't taking over the entire family. I know that that was really something that I tried to do, is made sure that my girls especially had things that made them feel important and made them feel seen. Because so often a child with special needs takes over the entire identity of the family. So it's important to recognize how everybody is feeling. We host a sibling group here at the Utah Parent Center. It's a support group for siblings of people with special needs. Each month, the project hosts different activities for different age groups. We post about them at the beginning of each month, and space is limited. So encourage your families to register early. Look in your emails each month. And if you think that you have a sibling in your family or somebody that you are, family that is under your care, please make sure that they know that this is something that we offer, and it's meant to be a safe place for kids with siblings with disabilities to be able to talk freely, to vent, and to just have a break from their sibling at that moment. Educating your child about their diagnosis. So here at the UPC, we emphasize self-advocacy as being a very important part. It's important to start early to help your child understand their diagnosis. Educating a child about their diagnosis is teaching them to be a self-advocate, and it can be very helpful to them in the long run. Teaching can happen at all levels. Sometimes I think we think that our kids don't understand or couldn't possibly understand what they're facing, but it's important to realize that they're capable of so much more. It's great if a child can help explain to somebody else about their condition without feeling embarrassed, or that they don't have to just be the one to carry that burden quietly. Okay, number 10, take another deep breath. You know what's important. Again, remind parents to focus on what is important. Some parents say that getting a new diagnosis is a roller coaster. And as that might be true, we can invite them instead to look at it as a fast-moving car that takes them up and down and sometimes turns their stomach. But try to look at it as a long, steady race that you can win if you keep a good pace. A new diagnosis is not the end of the world, even though it may feel like it. It's just the beginning of a new and different world. And I think
Gretchen,
that's, yes.
Can you hear me? I'm sorry. Can you let me like a reset and see? Because I don't know why the slides aren't showing
Oh,
complete.
what's she saying?
So then let me see if I can.
So you can't see the slides?
Well, no, I can't. Can everyone see it completely? Because I couldn't see it before. Like it was like chopped.
Okay, so we're on slide 14, Liliana.
Yeah. But can you see the full screen? Because I wasn't able to see the full screen. So I don't know if it's on my end.
It looks what
It looks good from here.
Okay.
Okay.
Yeah. Sorry for the interruption.
That's okay. All right. So anyway, a new diagnosis is not the end of the world. You may feel like it is, but it's the beginning of a whole new world. Okay, we're going to move on to slide 15. Okay, other resources for families. The Utah Parent Center has published several handbooks with comprehensive information on important topics for families of children with disabilities. Much of this information is also available on topical information sheets, as well as information sheets that can be found under the publication tab. And here we have some links. You can join our contact list today. And we're always happy to send out any information that anybody might need that we have access to. And so this concludes our presentation. I really want to thank you for taking the time out of your day to learn a little bit more about the Utah Parent Center and Utah Family Voices. I've included my contact information as well as Lillian's contact information. If you have any questions, we're going to take some questions right now, but if there's anything that's more serious that you'd like to email us or give us a call, we'd appreciate that. And thank you for your time.
Thank you all. And then just so that everybody is paying attention to in chat, Rebecca Foster has also added some of the links for services that are comparable to North Dakota.
Oh, great.
And we'll just take a few minutes for questions that people have. There's one in here from Crystal that says, could you explain the difference between the Parent Center and Family Voices?
I'll help with that. Sorry.
Go
Does that
right
help?
ahead.
Yeah, so, and actually I'm going to mute.
Oh, well, now we can't hear you.
Okay, can you hear me now?
Yes, but come closer to her screen. Sorry. You guys were probably getting an echo.
Thanks
Hi,
for bearing
guys.
with us.
Yep,
Yeah.
no problem. So Utah Parent Center houses a bunch of different projects. One of them is our PTI, and so that's our Parent Training and Information Center, and that's where what you would typically see and be used to out of a parent center around the country. And their main goal is to help support families that have kids on IEPs and 504s to understand those school rights, and that's what they focus on. Family Voices is more focused on health and medical resources, but we both are trying to help families learn how to advocate for themselves. We both focus on children and youth with special health care needs and that disability community. So, and again, in Utah, we're housed in the same center. In other states, it might function a little bit differently. Like California has like 9 parent centers, but they only have 1 Family Voices affiliate. So it just might look a little bit different in different places. Does that help at all?
Yes, thank you.
Yeah.
Hopefully for Crystal. Anybody else have any other questions or? One question that I have that I get asked a lot by parents is about their insurance. So do you guys have help support families with those questions, or is that more for the integrated care coordinator and connect them with that? Do you guys
If
know?
it's for private insurance questions or marketplace insurance, we really don't have a lot of experience with that. We can help families. I would actually refer a family to like Take Care Utah for Medicaid support and things like that. But we can help with the Medicaid application process with SSI. We can help with social service processes and applications and things like that.
Okay, well, we'll just give it another minute for any other questions or comments.
We do sometimes help families learn how to, again, advocate for themselves, either to their HR departments or with their insurance companies. But most questions that families have, we do have to tend to have them refer back to their insurance companies.
Great. Okay. Thank you all for your time. Gretchen, nice job for your first day on the presentation. That was awesome. And thank you, Lillian and Kathleen, for jumping in. I'm going to have our case presenter, Kaylee, speak so I can find you quickly on our screen.
Yeah.
Okay. There is your slides. Can you see them? You tell me when you want me to move forward.
Yeah, sounds good. Hi everyone, I'm Kaylee Klingbeil. And actually the child we're talking about decided to join me for the next few minutes. This is William. And I know you're not supposed to do PPE. I'm a provider myself, but he's here. He wants to say hello. Can you say hi?
Hi.
Hi.
Yeah, so I have a unique perspective in this as being a parent as well as also being a provider. So I'm a PT, and prior to all of this going down with him, I actually serviced early intervention and the schools in Oregon in the community we were living at before we moved back home to North Dakota. So I understand both sides of this. So this is William. He's 28 old little guy. And I'm just going to start by going through kind of like the gamut of just his case of, like what diagnosis he has, what he's receiving, services, things like that. And then kind of break down a little bit more of like what we've been through with EI. So his diagnosis. Okay, hey, why don't you go play with Bubba? See you later. I know. So we were not, when we started early intervention, we were not seeking a diagnosis. That came along with it. Being a provider myself, we had some concerns about his general development. And at the time, our pediatrician, we were really struggling with, and, we got, third sibling. He's, he'll grow out of it. He's just, he's probably just behind because his brothers talk for him or do things for him. So we were just trying to get someone else to advocate for him, and they've done a great job of doing so. So the only thing that we did know was that he had left hydronephrosis and left unintended testes. We actually saw that in utero, but didn't get an official diagnosis until 6 weeks old. From there, he received surgery for that. And at the time, as we were going through that, he got that surgery around 9 months old. But eventually we ended up with, he was still not, we weren't seeing, typical progression. And so then he was diagnosed with failure to thrive. And during that time, he ended up with a G-tube, and that led to an emergency G-tube placement. Hey, I know we're in Daddy's office. An emergency G-tube placement that led to a VSD diagnosis. And at that point in time, we also knew that during one of his surgeries that he'd had, that he was having some problems with his hematocrit and hemoglobin levels. And that led us to a diagnosis of thrombocytopenia, which then led to what else is going on. And so his official diagnosis for all of this overall is Jacobson syndrome or 11q syndrome. And there's multiple types of 11q syndrome. but he has Jacobson's in particular. And we found that out at 13 months old after going through everything else. But in that point in time, that's when we realized we were seeking a diagnosis, is when we started getting all these other diagnoses. But with that also comes a diagnosis called Paris-Trousseau syndrome, which not every Jacobson's child has. But that deals with the bleeding disorder, and thrombocytopenia is part of that. At the time, before we got all of these things going on, he had plagiocephaly, and I was concerned about him needing a helmet. And that led us to a self-referral to early intervention. At the time, we had a different pediatrician, and that pediatrician really felt like it was unnecessary. And so I was seeking a second opinion, and I knew that early intervention was a great advocate for patients, would also be doing, assessments. And so we would have, official assessments to go off of to talk to the pediatrician about. And then he was also getting feeding therapy around that time, just because he was not eating very well. And then now he's on OT, and he's had several PT consults. He's been on PT. As far as like in early intervention, we started out with because of feeding issues. And then he also had just some general developmental delays. And so we had OT. Rebecca's been great. She's been our OT, and she has, that's been our main thing, has been feeding and OT. Eventually we had a PT consult as he was not progressing. And then we've had recently had an SLP consultation. You can go ahead and switch slides. And then on top of that, we also received a ton of outpatient services, feeding being the main one, just because of his failure to thrive. And that was the main concern at the time as we were seeking our diagnosis, his diagnosis. And SLP, we started out with an SLP, and then because he also has hypotonia with his, and so they were thinking about oral motor therapies and strengthening of the mouth, as well as just some sensory issues. And then that led to, okay, maybe we need to try SOS therapy. So that moved us to OT and then SLP. And then after he got his diagnosis is when we started PT. So all of these services played a major role in the diagnosis process. During all of those times, the first surgery that he had was the left orchiopexy, right hydrocele repair. And that was for the undescended testicle, and and then we found out during that time that he had a hole in his scrotum, and so they had to repair that as well. And that is a very typical Jacobson kiddo thing. We had no clue when we went in there. And then during that time, he was hospitalized because we had started with a new pediatrician who, through EI, they had major advocate for, hey, maybe you should look at a second opinion as far as a pediatrician went. And at that time, our pediatrician is the one we have now, and he's very hands-on, and he's been amazing. So he decided, you're pale, let's go get some lab work. And we didn't leave the hospital after that lab work. And that's when they found out about his bleeding disorder, which then led to bone marrow aspiration through our first hematologist. And then during that time, he was still dealing with failure to thrive, and that was our pediatrician's main concern. And so that led to a G-tube placement at 12 months old. And while getting the G-tube placement, the pediatrician on call at that time found the VSD, or the ventricular septal defect. So then we had 6 weeks to get him bulked up enough to be able to do the repair for that. And then during that time, that's when a ton of specialists were brought in order to determine whether or not he had needed a diagnosis. And so we'd asked about geneticists throughout the time, and each time we were told insurance won't cover it without certain procedures. then we get to the point with the G-tube, and the specialists there were like, absolutely not, we're bringing the geneticist in now. And that's when we found out, they did the genetic testing. It took us about a month to find out that he had Jacobson's. And then just part of his diagnosis is that he will likely have ear tubes for a large chunk of his life, if not all of his life, just because it comes with structural abnormalities, specifically of the cranium. So that's where we're at. But the reason why I left this list of specialists on there was just to kind of show you everyone we've been through in order to end up with the diagnosis. I didn't quite put it in order. I probably should have, to kind of show that. But we went through a lot of specialists before we could figure out a diagnosis. And mainly due to the fact that our first group of specialists that we saw didn't quite play nice with each other. And so we were fighting the diagnosis process that, you know, one felt like, oh, insurance will do this, or, you know, I think this would be a better route, and none of them were speaking. For us, we are blessed to have a program out in Fargo through Sanford Health that is like a specialty program in which they sit you in a room with every specialist they think you need, and they discuss the case right there in front of you. So, I mean, we were really blessed to be able to be put in that program. And that's when we started to see everything come together and started to really see how much that made a difference of just having everybody on the same page. But as you can see, it's an extensive list of specialists. And the main players in that, I would say, were for him, the hematologists, because they were worried about his bleeding disorder. Our pediatrician has been amazing. And then we've got the team that we see currently is the geneticist, the endocrinologist, cardiologist, and hematologist. I think I might have said that one already. And then the urologist, because he's going to have an ongoing kidney problem. But the major roles that led up to it were the feeding team came in first, and then they recognized the fact that he had structural abnormalities, and then said, no, we need to get the geneticist in here. And the immunologist felt the same way. So that's kind of our journey through the diagnosis process. So I'll just kind of go through that. The pediatrician, we had to switch, as I mentioned, and then the plagiocephaly is what brought us to early intervention. At that time, with the plagiocephaly and then him just not meeting his milestones, we were really concerned that our pediatrician was not suggesting outside services. And then when we switched to the new pediatrician, all of a sudden there were very different concerns that I had not thought of. As you can see, I'm very pale. I'm a redhead. And so skin pallor was not something I was expecting to be a concern at all. And so luckily we had him, and he thought outside the box. And then, as I said, we went through the surgery process, and he had several blood transfusions during all that, and a bone marrow aspiration. Because at the time they were considering that he had cancer. You can go ahead and switch. And then the major portion of this was the failure to thrive. The fact that he was eating constantly. He was nursing at that time, constantly nursing, and was not gaining any weight. But the strange part of that was that he was still growing in height. And so that was kind of the major factor, was that his growth was still continuing, but he was not gaining any weight. And so that was kind of one of the key elements for us. And then he has G2 placement in and all of those things. And then his repair came about 2 weeks. His repair came about 2 weeks after we found out what was going on with the Jacobson syndrome. And from there, we don't really know what his future outcomes are, because it's considered a rare diagnosis. There are 50 known cases, and they're assuming there's roughly 200 cases in the world. So at this point in time, lots of therapies were started, and early intervention has been huge in helping us manage all of those things. And throughout this process, the role that has been played has just been an insane amount of advocacy and support. And as I said, as a professional, I think it's a little different for me, because a lot of the unknowns for most parents were kind of known because I had already, as a professional, I'd gone through the process with other families. And I think it would have been a little bit more chaotic and a little bit more scary had I not kind of already known what to expect to some degree. You can go ahead and go to the next slide. As far as our barriers to diagnosis went, as I said, the initial pediatrician, our initial hematologist just really was not aware of insurance and what they were requiring or what they didn't require in order to get geneticists in. And then also at that time, she basically told us at that time that if we did not work with her exclusively, she would not take us on as patients. And so, and at that time, myself and our other child was also having some blood related issues. So we have, in our family, we have pernicious anemia. And so because I was using a different hematologist and was asking that hematologist their opinions, we were basically kicked off of her case. So she kicked us out of the caseload. So that was a huge barrier because it was a major factor in his diagnosis. And then after that, it's just our lack of knowledge of the diagnosis process in regards to a genetic disorder. So especially my husband, and just like, even though I've done this as a professional, there's some insecurities that come with that, just some, should I trust this process? Should I, there's some, mother's instincts, as they say a lot. And I think a lot of it did come down to, even though having the medical knowledge, a lot of instinct of, and just the advocacy that we received from early intervention when there was some questioning of, is this the right way? And so being able to, they talked about in the last presentation, the checklist, staying organized. And that's something that early intervention did really well in order to help me keep my mindset going in order to determine what was the best thing to do for him. You can go ahead and go to the next slide. So as I said, that jumps into the strengths that we found, was just the continuing to monitor the progress of what was going on. So you mentioned the checklist and staying organized, and and each week Rebecca would come and she would just ask us, okay, who have you talked to, who's next, keep a list. And that helped a lot. By far one of the best things, because it's when you're going from professional to professional, you start to forget what each one said. And so being able to discuss that and being able to write all that down really did assist in our ability to be able to function and think throughout that entire process and stay on top of things. Also a major advocate for ourselves when we were really struggling as to whether or not to continue, particularly with the first pediatrician, the first hematologist. There was the reminder of just, you have a right to a second opinion. And, and if there's the concern that we had with our medical team was just that if we sought a second opinion, would they be cutting us off? And as a parent, if that's the case, then they're probably not the right team for you. If they're, because then they're not advocating for your child. And that was something that throughout the entire process, early intervention was very, very great about. No, like, you need to do what's best for your family. And then just the willingness to bring new perspectives, new ideas, new professionals. Okay, well, have you tried this? When we hit a barrier, there was, okay, well, have you tried this route? Who can you talk to your pediatrician about this referral? And so that was a major portion of it too. Was just there were so many things to see, and so many new people to meet, and you just don't know. Sometimes you just don't know what's been missed. When you're over here thinking about hematology, you're not necessarily thinking about, oh, he should be an OT. So you're going through all that. It's also, your child also still needs to be progressing, right? And so, and your family does. And so reminders of, hey, there's also, yes, you're going through this, and I know you want answers, but right now you're struggling with this. So let's get this taken care of. And that was great. And so, as I said, keeping track. And then I was asked to bring up areas of improvement. This was like, it was pulling straws. Like, I was really grasping at straws here, because I felt like out of all of the entities that we met, early intervention was our greatest support and advocate. And so to even have to come up with things kind of it hurt my heart a little bit. But I would say, and you actually kind of hit a lot of these areas in the presentation, was just the education aspect. For instance, my husband still has no clue what our service case manager does, or our service coordinator, as far as like the ISFP and things go. So I think that's an outside entity technically of the early intervention. But there, for us in North Dakota, is what helps get the Medicaid process started and kind of keeps your case on track. And so to this day, my husband has zero clue what they do. So he asked me to throw that on there because he's like, you're a professional, so you understand, but a typical parent would have no clue who this person is and why they show up once every quarter. And then the reimbursement process. And I think that on the North Dakota end, it was that allowed us to gain Medicaid through having a medical diagnosis and being admitted into the program. We did not have that prior. But because we were on it for medical reasons, we were told by many professionals, there's a 90-day back pay period, but that's not the case when you're on for a medical diagnosis only for socioeconomic reasons. And so a lot of that, we probably would have gone a lot slower had we realized that there was going to be massive bills at the end. And so that can be a strain on a family. Look, we're very blessed in the sense that it was not for us, but I know for other families that could have been a major strain. But just kind of understanding that process that comes along with it, if you do have, a Medicaid reimbursement process with that, or it comes with insurance in and of itself. And then just the typical diagnosis process, I feel like we're an exception. We weren't quite so typical, but I think had we known, sorry, my kid is destroying my husband's office. That'd have been bad. Had we, there were certain things like we went through, typically, like I have my two other kiddos also have diagnoses, not genetic, but other diagnoses for other things. And our most recent one, we went through a developmental pediatrician. That's out of all three of our kids going through this, that was the first time I'd ever heard of one. And so just understanding that like typically kids go through, either the neurologist, orthopedist, and the developmental pediatrician route. I don't know if it necessarily would have changed our circumstances for William himself, but our other children may have. We just didn't know. And in the area we were living at previously to William, there were no developmental pediatricians, and so it often went through that. And so just understanding like the typical diagnosis route for your area might have been a little bit more helpful. And then just kind of understanding each specialist role. I know that like as a parent, that can be very overwhelming. And so my husband was just constantly asking me, okay, why are we seeing this person? Who is this person? Why was this person recommended? And so being able to like, even if there's just a handout, like this person does, I don't know, but he's very visual too. So that may have helped. I think y'all understand that, obviously. It's just a matter of conveying that to the family. And oftentimes we don't know what we need at the time. And as professionals, seeing a gamut of things, just a general list or understanding of the different professionals you may become encounter with might help. And then the last one was just the general community connections. We are in a rural area. And so even to this day, we just moved back a few years ago, and I've not been practicing since then. So I'm not even sure until today's slides where we talked about family voices and the parent center and things. I wasn't really sure what was available. And I know when you're going through all of that and you're feeling alone, oftentimes it's really hard to think of that, of like, okay, who else could I be talking to? I know there was a presentation given last year by a local mom who was just talking about their process. And so I've gone to those things. But just that in and of itself can be a huge help. I will say that Rebecca did an amazing job at also reminding me that if I go on Facebook, oftentimes that platform can be used as kind of a venting process. And so when you're seeking a diagnosis and you're seeing this venting process, it can be very overwhelming. And she did a great job of reminding me that just because that parent's going through that doesn't necessarily mean you will. And so when you're seeking that, it can be almost too overwhelming. And so understanding the roles that this can play. So like a SIB shop, my oldest has a lot of anxiety over our child's diagnosis. And so, and all of the surgeries he's been through. But I also know that if there was a child that brought up something he had never thought of, that could actually be detrimental to him because he has so much anxiety. And so then we'd be going through that process. So it's it's different for every family. But just knowing what's out there and what organizations are for what is extremely helpful to a family, especially, as I said, it can be very isolating. You're not taking care of yourself, you're not taking, it's hard with the siblings. And so I would say that, maybe even just coming with a list of things, probably not the first day with everything going on, probably not the first day, but, over time, give them a few weeks to take it all in and just say, hey, I know you've been going through a lot. Here's some people you can talk to, or here's some people that may know what you're going through or has gone through it as well. I think, yeah. And then we added some questions to go through. So as far as Rebecca threw this in there.
Right.
Yeah,
So
go ahead.
I'm gonna stop for a minute.
Yeah.
And just, once again, thank you. You pulled together your case really nicely, and thank you for sharing with us. A few of the things that really hit me is that you had to become a master of everything, master of the healthcare world, those terminologies, those wording. That was a lot. So, and I liked your idea of coming together as a group, everybody being on that same page. And sometimes as early interventionists, that we forget to all come together and kind of talk about everything on it. And I also liked your feedback on just that general understanding. You were in this world, so you kind of know some of those things, but other parents may not understand that. Before we move to our questions that Rebecca is going to present, we're just going to stay in a large group for that. I just am going to open it up to the group to see if they have any things that they want to talk to you about or ask or.
Yeah, absolutely.
Okay.
I don't want to ask something necessarily, but Kaylee, it shocks me. I'm also a physical therapist. It shocks me that providers would be, I guess just the straight way to say it is so shallow that they would kick you off their caseload if you sought a second opinion. When you said that, I'm sitting there thinking, wait a second. I mean, that's what we want, right? As professionals, as a PT, if somebody maybe doesn't agree totally or just wants to get that second opinion, I'm like, yeah, go get that second opinion because more eyes is better. And I don't know. I heard you say that and I thought, man, that just blew me away. So from the professional standpoint, I apologize for that hematologist or whoever it was that was doing that, but that's got to be so frustrating and so unempowering as a parent to say, I either got to take this person because if I go look for a second opinion, I might lose this person. I might not be able to find somebody else. And so you're stuck. You're just like, okay, I guess I just have to stick with this person that I'm not totally comfortable with. So kudos to you for being an advocate. And like Janelle says, being a master of everything, knowing enough about everything. Unfortunately, not all parents are as well educated in the field and haven't worked in the field in that as you have. But that was a shocking statement that you made.
Yeah, I would say as a professional myself, I honestly was not expecting that. I've heard patients tell me that on occasion. I've done you name the setting, I've been in it. Because where we lived, we had to do it all. And so, yeah, I've had patients tell me that, but I was not expecting to hear that myself. And yeah, and it does play a major role in your decision. So, and that can be very scary for a family. And so for us, knowing that there was, like our physician played a huge role in that, of the sense of like, he knew what was available in the area as far as other hematologists we could seek out, or other professionals we could seek out. And so we were very blessed to have somebody that was knowledgeable in that. Otherwise, yes, that's the position I would have probably been stuck in, is, okay, if we leave, we have no answers, Yeah.
And that is hard for sure on all of it. There is just a comment on here. It says that they commend you and your husband's ability to manage all this and still be there for your kids. You're a super family, truly. So.
Well, I was going to add something. So my experience is that when you have a parent who is a professional, and they can be like you, Kaylee, a physical therapist, it can be, I've worked with families who are physicians, who are nutritionists, who, they run the gamut. And I think there's this belief on, not my belief, but it's a belief on the part of the professionals that you should know this stuff, And so you just know how to do development with your child. You're a physical therapist, for heaven's sakes. And I think we as interventionists and professionals need to realize that you are the parent first. And we need to come from the place of, you may not know all of this, so it's our job to let you know about this. And I say, from the top down to the bottom, we all need to treat you as a parent first. And I wonder what came into play, especially with your first pediatrician. Was he just saying, well, you should know this stuff?
Yeah, that's actually a good question. So no, that's actually not the route the pediatrician took.
Okay.
As a matter of fact, it was very interesting. Basically, I brought up the development side. So the assessment that they did initially for the plagiocephaly with the torticollis, he did end up having a torticollis as well, though that pediatrician refused to diagnose that. And so because it didn't look like what they thought it should look like, there was questioning in that sense. Hey, out, please. There was a lot more questioning in that sense. And at one point in time, the pediatrician actually said, oh, well, it came down to like, oh, he's your third child. So it's probably just going to look different because you're not used to having 3. And then eventually I brought it up again of just like, hey, this is my concern. And I reminded him, like, this is what I do for a living. I'm not trying to be, I'm not trying to be superior about this, or, but he just kind of laughed and he goes, well, I guess we do refer to you about these things. So, if you still have a concern in a few months, then I should definitely take that under consideration. And so it was just kind of I'm assuming that was just more his personality of like, let's just wait and see, because he'll probably just grow out of it because he's the third one. The second pediatrician had a vastly different viewpoint of that. It was just, you're the professional, you've done this. I was mainly in the pediatric realm at that point in time. And so, he took that more seriously and was like, oh no, if you're bringing up concerns. So I definitely never got the like, oh, you should know. It was almost the opposite of like, oh, well, you've only seen kids that are, that aren't doing well. And so you don't necessarily know what a typical child looks like.
Yeah. I saw Shelby's face as you were saying some of those things. And
yeah,
it's so heartbreaking, and how much more work could that we as each of us need to do to help educate with it. Other comments or thoughts before I reshare my screen and we kind of discuss these few questions?
I'll just pipe up my thoughts as
Okay.
Kurt and everyone was discussing, being a professional and a parent at the same time. I've had similar experiences, although I didn't have special needs kids, or even as a now caregiver for my parents, I tend no longer to announce that I'm a PT. And then I hear the doctor to patient story. And then if I want more detail, I follow up with, oh, and by the way, I'm a PT. And then they suddenly give me this different version. It's really eye-opening. I appreciate you sharing this, Kaylee, because I want to look at my own approach in practice and make sure I'm not falling into those same biases, because we all have our biases, and I think you've shed a lot of light on what those are, and so we can help support our families knowing that they're out there with professionals, and how can we support them in being the best advocate, but also in ourselves. This has been fantastic. Thank you.
I will say that the process of being in the profession does make it a little trickier, just because it's hard to let that go. And so that's something that I had to learn through this process. This is my second child that we've had. Well, technically it's the third, but the third one came during the first one came during the third one. But our middle child also had significant developmental delays. And at that time I was practicing. And so it's been really hard at that time. Through the first process, it was really hard to put down my professional hat and just be mom, especially since I was the service out in that area. It was very rural. We serviced an entire county of roughly 8,000 people. And I was the only pediatric PT, and I did all of it. Outpatient, EI, schools, all of it. And so at that time, if I needed help, it was me. So I didn't really get that. And so when this came down, I stepped out. And so I had to play mom in this occasion. And I look back between the two. I wish I had played just mom sooner with our middle child. And so, yeah, I think, being able to just kind of step back has played a huge role in this, as throughout the diagnosis process, and just being able to care for our family, because that's what came first. And and that's why I had to step back, and it's hard to do those things, but it's also what you need. And so being able to let the professionals be professionals was definitely a lesson I had to learn through our first child going through that. And then the second time it was a lot easier, and it just made the process a lot smoother.
Great, thank you so much.
Yeah.
So we're gonna just kind of talk about these, and we're gonna stay in a large group today. So the first one, and Kaylee, feel free to pop in your thoughts about this from that parent's perspective too. So the first one, how would you describe the service coordination role to parents so they understand what things the service coordinator would do or support versus what the EI provider supports? What's everybody's thoughts? And you guys know me, I am not opposed to just calling on people.
Hey, I'm gonna jump in, because this is a bone of contention for me, and it always has been. Certain programs you're not only the provider of service, but you are the service coordinator. And I think the family knows who you are and what you do. But in other programs where you have a service coordinator that, again, you see every 6 months, then my families do not know who they are. They say, oh, I got an email from so-and-so. Now, what does she do? And so I reiterate what they do. But I think it is a real problem in certain programs where they just don't know what the service coordinator does.
Yeah, I would agree with that. One of the things, and I think is anybody from DDI on here, or Okay. But both of you, Shauna and Pat, I know. And, or it's either Crystal down in Root for Kids. At the very beginning of COVID, one of your programs came up with a really nice introductory letter. That's ringing a bell to either three of you. I'll have to go back in, but it really described some of those things. So like when Kaylee, you were talking about that at the first, like, here is what a service coordinator does, and this is the piece, or here's what a PT does, and this is that piece. It was such a nice introductory letter. Does anybody else's programs do something like that? Heidi, Bill.
Yeah, sorry for the no camera. I have either allergies or cold. I know in Eliza's early intervention specialist course to get your credential here in Utah for an early intervention provider, she actually has a handout. I'm going to see if I can find it and maybe email it or put it in chat somehow. But it lists some of the common things that service coordination does. And so it could be really helpful for parents. There's even a spot at the bottom of it that says, like, you're supposed to input your name and phone number as the service coordinator.
That's awesome. Thank you, Heidi. I know oftentimes, so Pat, in up to 3, we are a dedicated service coordinator only. And I'm as a provider, and there will be many times that my families, I'll say, I don't know, reach out to your service coordinator. And they're like, I thought that was you. And I'm like, oh no, they have a whole different role, but that's a good point. I don't know how I would explain it to them.
Janelle, I was going to mention, I was in a meeting recently with the program director at Illinois, and I was thinking about a comment, Katie, that you made about your husband and service providers that were coming into your home, if I understood correctly, and he not really understanding, okay, so-and-so's coming into our home, and what are they working on exactly? And one of the things that Illinois does, they take it a step further. They're not just describing or providing information about the service, but they actually have many autobiographies. So every provider actually has a paragraph of what they do, a little bit about their education, their specialty. It's actually great, and families eat it up. So it just gives a little bit more detail about this particular provider. And it's been really valuable, and families have really appreciated having that information, and that's neat.
Well, I'm going to jump in again because the program that I'm in, we used to be the service coordinators as well as the service providers. And it was a hard job, especially if you had a family and a child that had multiple services. Like if they needed multiple things, you as a service coordinator had to coordinate everybody. And I know that's why we get away from that way of operating. But by the same token, I think families need to know that they have an advocate in their service coordinator, and there has to be some way for that process to be better understood by the family. That's what I'm saying, because I talk about who their service coordinator is all the time. But I think it's how can we make that piece of EI more impactful? That's where I'm coming from.
Hey. Okay. Kurt just had me nervous that you were seeing my other screen with my grouchy daughter on there instead of the questions. So okay. So our next question is, so if a child requires additional supports of equipment, medical procedures, etc., how do we help a family navigate that insurance, the Medicaid system, Part C funding that might fill in the gaps, like assistive technology, devices, etc.? What are some of the things that people might do? Here in Utah, does anybody know about the Take Care Utah program? So that's what I do with a lot of my families that especially are working towards seeking out Medicaid. Is there is a whole program, it's called Take Care Utah, that does help support that process. And the other one, and I think they shared it in their presentation, is the integration care coordination clinic through DHHS that will work to help parents support this. I know we
assistive technology centers are also a good resource to help get loaners and try things out before you actually committed. And we just had a family that was able to get a $500 grant to help purchase assistive technology too.
Yeah.
I'm gonna be the mouthy one again. I think when it comes to, like, we need to break this up. So medical piece, the medical assistance is one piece of it, but equipment is another piece of it. And I know Kurt, you jump in, but I know that when a family has, either Medicaid and or, insurance, that the insurances are very reticent to provide help because of that long term, especially with a wheelchair. It's 5 years between getting the wheelchair and getting a new wheelchair. So I know that I always look to Shriners, I look to loaners, I look to all of that to be helpful before I turn to Medicaid. And I don't know if anybody else does the same thing. But then as far as medical procedures, what's out of my...
I can say that in North Dakota, like for durable medical equipment, things like wheelchairs or other devices, what we seem to see is that the Medicaid will automatically deny first. And then you have to start this advocacy process of having the pediatrician write a letter and maybe the physical therapist write a letter or whatever, depending on what it is that you want. And so then it's hard to know, like, at what point do they give up on Medicaid as being an option? And then what other funding is going to kick in? And for us, it gets difficult to understand sometimes what other funds are available to families through HHS under the Developmental Disabilities Division, which is where our service coordination comes from. So, we might hear that there's other funds that might be available, but like they control the purse kind of. And so that's where it gets challenging to understand, what they can access for families and what that process is. And when do they switch over from trying to get Medicaid to pay for something versus something else? So it is kind of complicated. And I think that's where the service coordinator role could be better explained, or like they could explain to families better what they're there for, as far as, they're more than just signing those authorizations or creating the authorizations for the Medicaid. They are there to be advocates and to make sure families get the resources that they need. But the EIs in our state end up being kind of the case manager, where we're the ones coordinating for meetings and, getting families resources. And so it's just, I don't know, like, I would love to know how to make it better, but I do feel like it's confusing for us, even as providers, to be able to explain to families how it works.
I agree with you there. I'm gonna hopefully not offend this Kathy Weaver. She is from the Help Me Grow Eastern, And I know you guys give a lot of resources and supports to families. Do you have any thoughts or ideas on this question? Oh, I saw you come off mute, Kathy, but I can't hear you. Okay, I'm not hearing you. Maybe put your comments into the chat. Oh, yep, my microphone is having a hard time. I know here in Utah, we do have that great resource of Help Me Grow that does also help families with that. Rebecca, I don't know if you guys have something like that in North Dakota. You're like, I don't know. Okay.
If you let me pipe in for a minute, I know this is kind of where I feel like it kind of crossed for me as a professional, because I was in Oregon. Because of our area, I was considered the service coordinator at the time. And so I think one of the things that I had to spend a lot of time doing was understanding some of the waivers that were available. And then I know that our director at the time spent a lot of our resources on looking at Medicaid processes, and we spent a lot of time on, in different trainings and learning about the different waivers that were available. And I know that for the families in particular, I feel like it's a major point of concern, and can be one of the major things that can prevent them from seeking a diagnosis to some degree of, or even seeking out equipment. For instance, we thought William was going to need a bed for like the G-tube supplies, and we had no clue how long he'd be on it. Now he's off. But he also has a lot of respiratory issues. And so like knowing different like waivers that are available would be helpful. And then, sort of a general knowledge of the Medicaid process was very helpful for me when I was the service coordinator at the time. But I will say that there, especially in rural areas, even knowing some other things that are available, like I had a grant writer at my expense. And so like looking into those things, I think even though you've already got a lot on your plate, especially if you play service coordinator, can be one of the biggest advocates that you can provide for a family, just because those things are the big things that are on their mind. The diagnosis process, though, is quite overwhelming. The things that come afterwards, the equipment, all of the expenses start to rack up in your brain very quickly. And I know that was oftentimes one of the biggest things that our families would ask for was, wheelchairs, beds. And then as far as like our, one of my nephews actually has pretty severe autism, and they were told that you could not get a bed if it was for behavioral reasons through Medicaid. And so looking into like organizations for autism in particular was very helpful for them to be able to get a bed that allowed him to stay safe at night.
Well, thank you for sharing. And we are at time, so I'm just gonna again thank everybody for their contributions and for joining today's session. And then Kaylee for sharing your story. I think it's a great perspective to remember that the diagnosis process for families is not an easy one. And there are some resources out there, and what we can do as providers to change our perspective. I don't know if Michelle is still on there, but I really liked her perspective that she shared to do some self-reflection. There's Michelle, thank you. That self-reflection of how are we sharing that with families. We have our next session in May, so that will be May. I'm looking at my calendar, May 7th, and hopefully we'll see you all there. And thank you for your time. Enjoy the rest of your day, depending on what the weather is like in your neighborhood. Thank you.